Hi, my name is Tamia Singleton, and in this video, I will discuss internal tube feedings. First, I will verify my physician's orders. Then, I will identify my patient by asking them their name and date of birth. Then, I'll check for their allergies. Next, I will perform hand hygiene. Then, I'll don clean gloves. After that, I will prepare my internal nutrition. First, I will shake my formula. Then I will pour from a can into a designated bag. Then I'll connect my tubing. Then I will prime my tubing. After that, I'll place my patient into a high Fowler's position. Then I'll check my tube placement by checking the pH levels. After that, I will check the residual contents. If the content is less than 250 milliliters, I will replace the contents. If the content is greater than 500, or 2 checks greater than 250 milliliters within an hour, I will stop the feeding. When the content is less than 250 milliliters, I can go ahead and flush with 30 milliliters of water. Now I can attach my tube feeding to my nasogastric or gastric tube. Then I can turn on my feeding per order. After that, I would start my feedings. When I am doing a bolus feeding, I will utilize gravity to instill the prescribed feedings. Then I will flush it with 30 milliliters of water. During a continuous feeding, I will flush with 30 milliliters of water every 4 hours. During an intermediate feeding, I'll flush with 30 milliliters of water before and after. I will need to do a residual content check every 4 to 6 hours or per agency protocol. Then I will need to change the administration sets, the tubing, and the feeding bag every 24 hours. Then I will need to assess and clean the abdominally placed tubes and insertion site daily. Then I'll document the feeding, the residual content, the appearance of the site, nausea if present, and the intake and output.